Hello everyone and welcome back to the channel. Now in today's video we are going to talk about what you need to do during the Medicare Annual Enrollment Period. My name is Colin Wattenville and I run an insurance agency called Modern Health Solutions that has helped over 1,000 individuals, families, and businesses with their health insurance needs. The Medicare Annual Enrollment Period, also called the Annual Election Period or just simply put Medicare Open Enrollment Period, runs from October 15th through December 7th every year. And it's a very important window, especially if you are on one of the two main setups for Medicare, because it can actually be your only chance to review some of your coverage for the next calendar year. As I just said, there are two main setups that you have if you are on Medicare. Setup number one is you chose to do the Medicare Supplement plus Prescription Drug Plan route. And setup number two is you chose to go with a Medicare Advantage Plan. Now, no matter which of those two routes you find yourself in that you've gone down already, this is the time of year where you need to take action and review your coverage for the next calendar year to look into different changes that may or may not be happening to your coverage. Let's say you find yourself in situation number one. You're somebody who chose to get a Medicare Supplement and a separate prescription drug plan. So if that is you, if you're in this pool of people, then first off, regarding your Medicare Supplement, this annual enrollment window has nothing to do with your Medicare Supplement. So you can rest assured this is not a time crunch to review your primary supplement, your Plan G, Plan N, Plan F, whatever you have. This enrollment window has no bearing on your Medicare Supplement. You can actually look into switching your Medicare Supplement any time of the year, and you don't have to feel pressured during this short window to review that coverage. But if you have a Medicare Supplement, 90% of the time, you also have a Medicare Prescription Drug Plan, or PDP, Part D plan. Now, this short window is imperative for you to review that coverage, your prescription coverage, because it's actually the only time that you can review your prescription drug coverage. If you miss that window, then you are stuck with your current drug plan. It'll just automatically roll over for next year, assuming it's still available, of course. And regardless of the formulary changes or if they switch their pharmacy network, you are still going to be stuck with that drug plan. So October 15th through December 7th, that little window for the Medicare Annual Enrollment Period, it's very important if you have a Medicare Supplement and prescription drug plan that you are reviewing that prescription drug plan during this time. So why even review your drug coverage? Why review that prescription drug plan? Well, as I already mentioned, a couple of different reasons. Companies will change their formulary year to year. So one of your prescriptions might have been a tier 2 medication for the current year, but next year might be jumping up to tier 3 or tier 4, meaning you're going to be paying more. Or the opposite might happen. Maybe you are on a prescription right now and new regulations have come out. Maybe there's a generic version now, whatever it is, where that current medication now will cost less for the next calendar year. And obviously that's something you want to factor in when looking at all of your costs for your Medicare coverage. So not only do formularies change, companies will also change their networks for their prescription drug plans. And that's something a lot of people don't think about. Pharmacies are in different networks with different prescription drug plans when it comes to Medicare. You might have CVS in network as a preferred pharmacy with your plan this year, but due to the contract negotiations that happen on the back end every year, that pharmacy might be a standard pharmacy next year, and you have a higher cost share for your next year's plan. Even though it's the same plan, same pharmacy, there might have been some things that happen on the back end where your costs will actually be different. And that's of course assuming that your situation has not changed. You know, think how often it is, do you have the same medications that you had this time last year? Probably not. Hopefully you got off a couple, but sometimes maybe you got on one or two more prescriptions. So the prescription plan that you have right now might not cover these new prescriptions as well, and this is the only window of time when you can shop for different prescription drug plans that might cover that new medication better. So that's the first pool of people. The second pool of people is those who have a Medicare Advantage Plan. Now, if you have a Medicare Advantage Plan, it often comes with prescription drug coverage wrapped into it. So everything I just said about the standalone prescription drug plan for that other pool of people, just take that and apply it to those of you who have a Medicare Advantage plan that has built-in drug coverage, because all the same stuff applies. Formularies change, pharmacy networks change, maybe your medication list has changed, so those all still play a factor as to why you should be reviewing your Medicare Advantage plan during the open enrollment window as well. However, when it comes to Medicare Advantage plans, there's another piece of the puzzle that is a reason for you to review your coverage during the annual enrollment period, and that is because Medicare Advantage plans, unlike Medicare Supplements, Medicare Advantage plans will have a network of doctors. So those change as well every year. It might be that all the doctors you currently see are in network with your plan, but maybe there's been some network negotiations on the back end and your current providers, your current doctors, dentists, whatnot, are no longer covered under your plan for the next calendar year. And much like with the prescription coverage, maybe the networks have stayed the same with your Medicare Advantage plan, but you now need to see a new specialist, or you have a new doctor that you have an appointment scheduled for that you've not seen yet, so you're not 100% sure whether or not they're in network. So again, this time frame here, the annual enrollment period, is when you want to check for all that stuff. Check for your prescriptions, doctors, formularies, networks, all of the above if you have a Medicare Advantage plan. Furthermore, if you have a Medicare Advantage plan, the actual coverage itself changes year over year. Medicare Advantage plans do not have standardized coverage, whereas if you have a Medicare Supplement, as you probably know, a Plan G is a Plan G regardless of the company. That's all standardized. Medicare Advantage plans, their coverage can actually change year over year. So you might, for example, have a $400 copay for an ambulance ride one year, but then if you don't check the changes, the summary of benefits on your annual notice of change letter, and you overlook that that copay for next year is now $1,000, you might not be too happy when you go and need that service and find out your coverage, your copay or your coinsurance is a lot higher for next year. So not only do you want to check your prescriptions and doctors if you have a Medicare Advantage plan, you also need to check the actual coverage itself. See what the new max out-of-pocket is. Is there a premium for your plan now, whereas before it might have been $0? You want to look and find out all the nuances and all the changes that are happening for your actual coverage if you have a Medicare Advantage plan. Now, I would be remiss if I didn't mention something else that goes along with Medicare Advantage plans. So during the annual enrollment period for Medicare, the annual election period from October 15th through December 7th, that is not necessarily that big of a deadline to worry about if you already have a Medicare Advantage plan, because there's actually a separate window of time during the first quarter of the year. Everyone that already has a Medicare Advantage plan can actually change to a different Medicare Advantage plan during the first quarter of every year. So the December 7th deadline is not necessarily a end-all be-all and a scramble if you have a Medicare Advantage plan already, because again, if you miss that deadline and you find out later that you do need to make a change still, there is that little buffer zone. There is another 3-month window right after the first of the year to switch your Medicare Advantage plan. And of course, the government makes this all confusing in terms of the wording for things. That period of time is actually called the Medicare Advantage Open Enrollment Period. So Medicare Advantage plans, if you're a customer of those types of products, you have 2 separate windows. The annual Medicare Enrollment Period, which again is October 15th through December 7th, and then you have the Medicare Advantage Open Enrollment window, which is the first quarter of every year. A couple other big picture things I want to talk about real quick before we wrap up the video is that this is the only time someone that has a Medicare Supplement can switch to a Medicare Advantage plan. So if your supplement prices have gotten super high and unaffordable and you want to look into a cheaper alternative that Medicare Advantage plans often offer, then this Medicare open enrollment window, October 15th through December 7th, is the only time frame where you can jump off of your Medicare Supplement plan and enroll in a Medicare Advantage plan without extenuating circumstances like a Special Enrollment Period. And something else I kind of already alluded to but want to speak out and be crystal clear on, another reason to shop your plans during this time period is that the plans itself are changing, meaning the options are always getting smaller or more. There's new companies that might be coming into your market. Some companies that are already in your market might be discontinuing certain plans. You might see entire exits where a big carrier just completely stops selling a prescription drug plan or a Medicare Advantage plan altogether. So there's bigger picture changes that I wanted to also mention in terms of new companies, current companies exiting, all those sorts of things. That is just another reason why you should be reviewing your coverage every single year during the Medicare Annual Enrollment Period. So after watching this, you should understand the importance to review your coverage every year during the annual enrollment period with Medicare. And something that I let on to all my clients, if they give me a hard time for bugging them during October of every single year, I tell them somewhat jokingly, tongue-in-cheek, that I don't want to review your coverage every year either. You know, I'd rather just set you on a plan and forget it and keep getting paid a commission off of the plan I originally signed you up for, because that's how we get paid. As long as you keep a plan that you enrolled with us through, then we keep receiving commission. But I wouldn't be doing my job well, and I couldn't sleep at night if I just set customers and forget them on plans, right? Because of all these changes, all the back ends with formularies and networks and customers getting new prescriptions and or new doctors, it's really my job to make sure they are on a good plan for them every single year. And part of that, sadly, unfortunately, is a mad rush during this last quarter of the year to review everyone's coverage in a very short window of time. Of course, it goes without saying, if you need help reviewing your plans during this enrollment window, then please reach out. That's what I'm here for. I also have a bunch of agents that work with me to help review clients' coverage every single year. And there's no downside really to using an agent. Our services come at no cost to you, so I always tell people, why not seek the help from an expert who deals with this stuff every single day, save you a lot of time, hassle, and homework from doing all the checks and balances in terms of networks and prescriptions and pharmacies on your end, digging through all the summary of benefits to see what plan has a less copay for a specialist than the other. All that kind of thing can be done through an agent, and you don't have to deal with all that work. That's what we're here for. That's why we get paid by the insurance companies, is that we help you find the best plan for you and your specific needs at no cost to you. If you found this video helpful at all, it would mean the world if you hit the like button. Also, feel free to subscribe so you can stay up to date on our latest videos. Share it with a friend or family member, comment your thoughts down below, or even just hit follow on your favorite social media platform. Again, my name's Colin Wattenville. Thank you so much for watching, and until next time.